Good evening and welcome to For the Health of It Health Matters. I'm your host Tammy. Playing in the background is my country tizzy, part of my patriotic tribute to everything. so if you're a real patriot, then you can say, "Hey, thumbs up." All right, everybody. Thanks again for joining me tonight. I really do appreciate you. Of course, I am on YouTube, on Podbean, of course, and on YouTube Live. Uh, um, so please do me a favor and tell somebody about uh, the podcast. Tell them about YouTube Live. I really want to get some people on YouTube Live to comment about different things. So I'm hoping that I'm going to get some people on here eventually, because I know there's a lot of podcasts out there and I get it. But hopefully people that listen to me would like to come on YouTube Live and make comments, etc., etc., etc. Again, I would greatly appreciate it. Tell somebody, as I said, about the podcast. I also have another podcast. It's called The Nation Podcast. It comes on Wednesday nights in the same time slot, 8 o'clock Central, 9 o'clock Eastern, 6 o'clock Pacific. It comes on Spreaker.com on Wednesday nights. Once again, that's the Nation Podcast on Wednesday nights on Spreaker.com. And I would greatly appreciate if you would join me on Wednesday night at that time. I am on YouTube, as I said, live. And I changed the name of my channel to America's Channel. And the A stands for action, the M stands for motivation, the E stands for energy, the R stands for responsibility, the I stands for initiative, the C stands for core care, and the A stands for all. And so I decided, as I said, to change my my YouTube channel. So again, I'm hoping that eventually somebody will join me tonight, but also, every Saturday night on YouTube Live, just like, I'm on Podbean. All right. We're going to go to some of the health news headlines. I wanted to talk about hospital medicine also tonight. I've taken prescription medicine, and I'm sure most of you that listen have taken prescription medicine as well. And thankfully, I was okay. I didn't have any problem with it, but I work in a hospital, and of course, I see a tremendous amount of medicine being given out. And I often wonder, if all that medicine is really doing the patients any good. Of course, I'm not a doctor. I'm just making my own observation. I have obviously no proof at all, that it is or it isn't. But that was just, one of the questions that I've had. Is prescription medicine really doing us, more harm than good? And so if somebody wants to come on and they want to ask a question, they want to talk about it, you may. Now, we're going to go again to a couple of news, go to some news headlines. Let's see. Now, this one, okay, so we're going to hold on for just a quick second. Let me go back up here just for a quick second. As usual, well, as usual, but not as usual, but there's so many, outbreaks of diseases everywhere. I mean, COVID, of course, was the main one for the past 2 years, but these other diseases have not stopped. I'm reading every week about old diseases coming back, new diseases. I mean, it's just a never ending, never ending, how should we say, cycle of these diseases. And it's sad again because obviously, a lot of these diseases are happening in less developed countries. And so, of course, that's always been a problem. These outbreaks are in less developed countries. And some of them, of course, come here simply because people bring them here, for one thing. But people travel and come back. That's how COVID came here, because people had it, came back and gave it to other people who spread it to other people. And so, of course, you know, that's how most diseases are spread, from obviously from one person to another. Um, and so, again, the unfortunate, as I said, thing is that most of these diseases are still in a lot of countries, and we get some of them. We don't get them all, but we do get some of them. And so I'll repeat my message. I'll get back on my soapbox and say, please take care of yourselves. I know it goes without saying, but I'm going to keep saying it anyway. Please take care of yourself. It's so very, very important. More important now than ever because, of course, of COVID. But also, again, all these diseases that are emerging and re-emerging. Some of these diseases hadn't been in outbreak for years. Some of them are coming back now. And, I can't stress enough how important it is, again, I'm on my soapbox again. Please take care of yourself, because it's not anything to be fooling around with and playing around with. People have died obviously from these diseases, and a lot of it can be prevented if we'll just take better care of ourselves. That's really pretty much bottom line, is that if we'll take care of ourselves, it will cut a chance of catching a lot of these diseases way, way down. So, like I said, it just bears repeating. But please take care of yourself, because having a healthy immune system, obviously, is so very, very important, because it fights off diseases that you may have contracted, and the severity of that disease is very important. If you have a strong immune system, I know what I'm talking about. I'm in a hospital, and so you already know you're surrounded by patients that have all kinds of stuff. It's like a petri dish, just stuff. And you never know what a patient has. And so, again, for me, that's been my focus, just making sure that I take care of myself. That's my number one priority. Is taking care of myself and trying to keep my immune system strong. That's why I'm taking all kinds of supplements and things like that to try to keep my immune system strong. It's just very, very important, as I said, to make sure that you do that, because the weaker your immune system is, the worse it is. The worse, you're going to, be impacted by anything that happens, any kind of medical problems that might happen. Okay, so again, I'm encouraging people to please take care of yourselves, please. This is again nothing to mess around with, nothing to play around with. So we're going to read some of these headlines. Many of the most nutritious foods are also the most sustainable. While it's relatively straightforward, I'm reading off my phone here, to compare the environmental footprint of producing apples versus oranges or even beef, These calculations become much trickier when foods contain multiple ingredients, and these make up the majority of what's sold in a typical grocery store. Up until now, there haven't been good methods to determine the impact of such food, but a team at Oxford, that's the university in England, has recently published some of the first work towards developing a sustainability metric for everything edible one might find it at the local grocery store. It says beyond their approaches to sustainability estimates, the Oxford team went on to cross-reference its results with the standard nutrition metric Nutri-Score. With this, they found that there were many win-wins where foods were both sustainable and nutritious, although there were a few notable exceptions. While the results weren't too surprising, this method offers a new metric for consumers, retailers, and producers to make more informed choices. Secret recipes. One of the biggest hurdles to calculating the sustainability of multi-ingredient foods is that producers are rarely required to list how much of each ingredient they put into a product, which is true. Quite the opposite. These details are often closely kept trade secrets. They don't want to reveal what they put in there because maybe they figure somebody will copy them. You know what I'm saying? But some countries, such as Ireland and the UK, at least some of this information is publicly accessible. The percentage of a certain key ingredients. The researchers at the Livestock, Environment, and People program in Oxford Health at the University of Oxford use these details from the Food B resource to estimate the percentages of ingredients in similar products, including over 57,000 food products that represent nearly all the foods and drinks in UK and Irish supermarkets. Once they had estimates of the ingredients, they used the Hestia environmental database to calculate the impact of the entire inventory. The team calculated an environmental score for each food that included a combined metric of 4 principal impacts: greenhouse gas emissions, land use, water stress, and potential to cause toxic algal blooms in the downstream bodies of water. Eutrophication potential. As a final score, they went to cross-reference their sustainabilities with the commonly used nutrition metric called Nutri-Score. This ranks food based on good nutrients such as protein, fiber, fruit, vegetable content, and healthy oils, as well as bad nutrients like calories, fat, salt, and added sugar. So it says we use Nutri-Score because it's fairly widely used in many countries around the world, and many researchers are familiar with the concept behind it. Said first author Michael Clark at the University of Oxford. The whole premise was developed to apply on a population level to result in better health outcomes. It's gone through a lot of validation and testing, and on a population level, it has been very effective at that. It says win, and this is the next segment says win-wins. When the researchers tested their method against products with known ingredients, they found that it performed well. The resulting sustainability rankings were also largely consistent on what would be expected given the main ingredients in any item. Our findings weren't super surprising, said Clark. For at least the last decade, there's been an increasing amount of evidence coming out saying that certain commodities have high impact, generally beef and sheep. Certain commodities have low impact, like plant-based foods, with some exceptions like chocolate and coffee. It says in general, meat, cheese, and fish, and anything made with these ingredients had the highest estimated impact. Anything based on fruits, grains, and vegetables ranked lower. Well, as expected. It says when combined with Nutri-Score, they were win-win products that were nutritious and good for the environment, like whole grains and produce. Potato chips perform particularly well due to their high vegetable content. That's good because I eat like potato chips. Other foods like nuts, fish, and meat were nutritious, but relatively harder on the environment. And so again, it just talks about, as I said, the food and what its impact is, obviously, on the environment, because we're going through this right now, the whole climate change thing and Green New Deal and all that. So they're asking people, of course, to think about, how the food is made, et cetera, before you buy it, and what impact it has on, of course, the environment, etc. All right. So that was that story. Okay, let's see. Okay, we'll just keep on reading for just a couple of more minutes for this site. Let's see. 7 Ebola cases, 1 death confirmed in Uganda. WHO scales up response? Again, as I said a moment ago about diseases that just aren't going away, they're still affecting people here and, of course, all over the world. Ebola is coming back. Ebola is still prevalent in Africa. Dengue fever outbreak. I hope I'm pronouncing that right. Dengue cases have been recorded in 75 out of 77 districts throughout the country. So this is in Nepal, which is China, part of China. Dengue fever. And so again, these diseases are not going away. Hundreds of people in southern Afghanistan contract tuberculosis. Again, I'm not trying to be a downer. I'm just telling you. And who knows if it's going to come here? You just don't know. Flu is expected to flare up in U.S. this winter, raising fears of a twindemic, which, of course, it's nothing surprising there. Flu season. That's why I'm saying what I'm saying. And so I'm going to be making a lot of chicken soup with garlic and onion in it this winter, because that will help you, not catch colds. A lot of garlic and a lot of onion, which I never thought I'd ever hear myself saying or even make, because I didn't like onions as a kid, and garlic wasn't really terribly my favorite either. But I realized as I've gotten older, you got to start doing stuff. Number one, again, because you're getting older. Number two, because of all these diseases and things like that. You gotta, you gotta make sure that your immune system is working properly. A lot of vitamin C, things like that. Doing anything to strengthen your immune system. All right. New Russian bat virus couldn't resist COVID vaccine and infect humans. See what I'm saying? I mean, and the list just goes on. I just read you about like 4 different diseases. And even though they're over there, COVID was too at one time. And look what happened. It came right over here. So don't say, it's not going to happen here, because it could. It's a wake-up call. I'm telling you, anybody listening out there, one or none, it's a wake-up call for everybody to please make sure that you're taking care of yourself. I can't say that enough. Okay. Let's see. Okay. Let's see. Okay. Don't cook chicken in NyQuil. FDA warns after TikTok challenge. And I have to laugh really, because now TikTok has I've never been on there, so I don't know. TikTok has all these crazy challenges, and of course now, the FDA has to step in and warn people. I mean, you can't really make it up. It's like, why would anybody do something like that? But then there are people who were drinking cough syrup, and for the life of me, I can't understand what that was about either. It's like, cough syrup. I remember taking cough syrup as a kid, and it wasn't pleasant. Like, what in the world? Why are people drinking this stuff like water? I mean, it's just like, it seems as if people will just do anything for attention. Anything. It's just crazy. So who would do that? Who would cook chicken in NyQuil? Who would do that? That's a drug. It's not water. It's a drug. An overdose of it could put you in the hospital. It's just so foolish. It says, who the heck wants to cook chicken in NyQuil? They're thinking of that flavor. I mean, if you've ever had NyQuil, you already know. I can't even imagine anyone doing something so foolish. I mean, it really, like, excuse me for just a second. I mean, really? Don't cook chicken in NyQuil, duh. Cooking chicken in cough medicine NyQuil is not only silly and unappetizing, but can be very unsafe. You think? I'm reading to you this story because of the absurdity of it. The U.S. Food and Drug Administration said following the Sleepy Chicken TikTok challenge. Okay, you notice I'm sitting up here like, okay, all righty. That's yeah. I mean, who in their right mind does that? Who does that? NyQuil chicken, NyQuil in chicken, and somebody would actually eat that. Okay, a number of videos challenge people to cook chicken in NyQuil, which contains acetaminophen, dextromethorphan, and doxylamine, or other similar over-the-counter cough and cold medication, according to the FDA. I don't know if you've heard this story, but oh, gosh. Boiling medicine can make it much more concentrated and change its properties in other ways, the FDA said in notice dated September 15th. Yeah, why not? You know, instead of broth, or I should say chicken broth, chicken NyQuil broth. Oh my God, and the emergency rooms again are full of, people just doing silly and stupid stuff. Nothing else better to do? Well, I tell you what, you could sure find something else better to do with your time. Whoever's doing this stuff could find something else better to do with their time. Even if you don't eat the chicken, inhaling the medication's vapors while cooking could cause high levels of the drug to enter your body. It could also hurt your lungs. This is not the first time the FDA has warned against social media challenges that use non-prescription medicine. In September 2020, I didn't know this, a similar warning was issued by the FDA after reports of teenagers getting admitted. Remember what I said just a second ago about the emergency rooms being full? And so you got these people that are doing this kind of foolish stuff and landing in the emergency room. There are people who are really need help. And so they are taking away from people who really need help. You see what I'm saying? Now I know that the police can't charge these people, but for the life of me, I'm just trying to understand what in the world is going on and what is in the minds of these kids doing this kind of stuff. What are they trying to kill themselves? What is it? In the emergency room, as I said a moment ago, when people who really have medical issues are there, the nurses the doctors have to take up their time with this foolishness. This was 2020. A similar warning was issued by the FDA after reports of teenagers getting admitted to emergency rooms or dying. Now, some died. That's really about as serious as you can get. I mean, I don't get it. I don't understand it. I don't. These young people are they're just lost. They're lost. Anytime they're doing this kind of stuff, they're lost. They don't have any direction. They don't have anyone, it seems to me, that's trying to point these kids in the right direction. Only a child who was lost would do something like this, knowing the risks. This is not fun. Anybody who thinks this is fun has some serious mental problems. Again, bored kids just looking for something to do. Their energy and their drive is not being channeled in the right way. It can't be. Not when they're doing this kind of stuff. Now it says right here that some of them have died doing this challenge. Benadryl, which is an allergy medicine, What is anybody doing drinking that stuff or taking that stuff if you don't really need it? Just for fun. Do you see what I'm saying? You understand what I'm saying about the seriousness of what's going on in our society? And people are just zoned out. They're just numb. They don't, it's like, they're moving around, but nobody's home. I mean, it's just a terribly, terribly sad thing to see. This is in my humble estimation, my humble opinion is what's going on. We got a generation of lost people. They're lost. They're not only lost spiritually, but they're lost naturally too. And only God can save these people from destruction. There have been too many. The graves are not just for older people; they're for younger people too, who succumb to this foolishness again in the somehow bizarre thinking that this is fun and harmless. How could anybody think, again, a thinking person, think that something like this was harmless? And TikTok really ought to be ashamed of themselves for even posting any of this. Yes, there's some responsibility. There's responsibility on the people doing it, but TikTok has to take some responsibility for this, and they're not taking any responsibility for all of this, and they should. These kind of videos should never be allowed to be posted. I get it. I get freedom of speech. I get the First Amendment. I get it. But this kind of stuff is killing people. Why is that okay? Why is it okay for them to allow this kind of stuff to be posted? That's my question. Why is it allowed to be posted? They should be taking this kind of stuff down. After participating in the Benadryl challenge on the short video app. I mean, crazy. And so, as I said, I'm trying to, like I said, I'm trying to again understand this and wrap my mind around it. I'm trying. I really, really am. This was 2020. The U.S. Food and Drug Administration on Thursday warned of serious health problems from higher consumption of over-the-counter allergy medicine, Benadryl, following a social media challenge on TikTok. The higher intake included serious heart problems, seizures, coma, or even death, the agency said. The FDA said it was aware of reports of teenagers getting admitted to emergency rooms and dying after participation in the Benadryl challenge on the short video app. Johnson & Johnson's Benadryl is used to temporarily relieve symptoms of hay fever, upper respiratory allergies, and the common cold such as runny nose or sneezing. The agency asked consumers to keep Benadryl out of children's sight to prevent misuse and accidental poisoning. Now, again, they had Benadryl in 2020, and now it's NyQuil. The Benadryl challenge is a dangerous trend that should be stopped immediately, Johnson & Johnson said in a statement. And the Benadryl and other diphenhydramine products should only be used as directed by the label. Exactly. I mean, again, it's just, I mean, really, I just have no words. I just have no words because it's just insanity. It's insanity. Somebody said, at what point do we just let nature take its course and weed out the ultra stupid? Just foolishness. And he says social media has done more harm to society and people than good. Unfettered, arrogant ignorance with absolutely no bounds or consequences. Yeah, I agree. No consequences. They just they just simply pass it off as free speech, and again, never accept any responsibility for letting this stuff be posted. Crazy. Somebody says, think about all the potential knowledge and talent they could have spread, and now think of the silly pranks and antics they have spread. Yeah, so many young lives lost for nothing. They have so much talent and potential to be doing other things. Not this. Not this. The potential that's being wasted. Again, just nothing. Nothing. Zoned out, tuned out. No ambition, no drive, no, channeling of positive energy. And here's an example of somebody not challenging that talent and energy right. Crazy. As I said, it's just, again, it's crazy. Just crazy, 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 crazy. So yes, this is what the young people are doing. Sad, isn't it? All right. Okay, we'll just read a couple of more headlines. Canada's sugary drink tax is 20 cents per liter. People are still going to drink it anyway. All right. Early deadly childhood diseases rise in Ethiopia's Tigray as war hampers vaccinations. Again, as I said, so many, so many. Pakistan's bloodborne diseases get out of control as deaths rise. I mean, again, it goes on and on and on and on and on. Since COVID is still killing hundreds a day, even as society begins to move on. Out of control STD situation prompts call for changes. Really? Again, the consequences of people's actions. That no people not stopping to just think about the consequences of their actions. Everybody's living for today, living for now, and not wanting to think about the consequences of their actions until it's too late. Then they want to blame everybody and their brother for what happens to them. The truth of the matter is that you made your own choice. Reckless, not caring, again, wanting to just live for now, have fun for now, get your groove on for now. I just want pleasure now. And the heck with the consequences until the consequences come and sit down at your front door. Then whose fault is it? That's the question I have. When it comes to sit at your front door, whose fault is it? Again, like I said, people living for now, and this headline says it all. Out of control STDs. Again, that's people just out there just doing whatever with whomever and not caring. My body, I can do whatever I want with it. Okay, well, go, have at it. But again, decisions have consequences. Choices have consequences. And most people are not prepared to live with the consequences of their actions. This is a no-brainer, okay? Somebody says stop shagging anything that moves and raise your standards. Yeah. That's something to think about, ain't it? Just jumping on, hopping on everything and anything. You don't know what that person has. That's it. Sharply rising rates of some sexually transmitted diseases, including 26% rise in new syphilis infections, reported last year, are prompting U.S. health officials to call for new prevention and treatment efforts. Again, this is a cost of the society letting down its standards. This is the cost of society telling people to do your own thing. And again, the heck with morals, the heck with celibacy. You don't have to be celibate. Okay, well, I'm reading the headline right here. The consequences of, again, not making wise choices. Because, see, this is your body. And the choices you make affect your body. The things that you do with your body affect your body. Again, have at it. Your life. Do what you want to do. Okay. But you're doing it at your own risk. You can call it lecturing, you can call it judging, you can call it whatever you want to call it. I'm just saying. I'm reading these headlines, and these headlines don't lie. Again, you're adult, do whatever you want to do, but these headlines, as I said, don't lie. 26% rise in new syphilis infections reported last year are prompting U.S. health officials to call for new prevention and treatment efforts. Imperative that we work to rebuild, innovate, and expand STD prevention in the U.S., said Dr. Leandro Mina of the U.S. Center for Disease Control, CDC, speech Monday at medical conference, Sexually Transmitted Diseases. Infection rates for some STDs, including gonorrhea and syphilis, have been rising for years. Last year, the rate of syphilis cases reached its highest since 1991. And I said at the beginning of the podcast about diseases coming back. Syphilis and some of these STDs have been pretty much eradicated. But again, people out there just doing anything and everything with everybody. High, drunk. Again, this idea that I can just do what I want and heck with the consequences. Again, until they come and lie down with you, sit next to you. You look up and there it is. You're in a hospital, sick, dying. And God knows how many other people have been infected. Now, these diseases, as we well know, don't have a cure. So God knows how many people these people have infected. Some of them are married, some of them are in relationships. And so they have spread what they've done with other people to their partners. How do you explain that? I got syphilis. And since I had sex with you, then you probably got syphilis too. Guess what? I got gonorrhea. Since I've been sleeping with you, you probably got gonorrhea too. Oh, by the way, I'm so sorry to tell you, but I have AIDS. And since I've been sleeping with everything I can jump on, guess what? You probably have AIDS, and they do too. Consequences, okay? Consequences. This is not meant to be doom and gloom, but I'm just saying. I'm reading it right here in 2022. These diseases haven't changed. They're still deadly. They haven't changed. There's no smaller strain of it. Once you catch it, you catch it. People have to stop being so selfish. We live in a very selfish society. I'm sorry to say, but it's the truth. Sorry, not sorry, really. We live in a very selfish society. People aren't thinking of other people. They're thinking of themselves. It's too late to say I'm sorry after the consequences have happened, when a lot of this was preventable. Infection rates with some STDs, including gonorrhea and syphilis, have been rising for years, and I read that. The rate of syphilis cases reached its high since 1991. The total number of cases hit its high since 1948. Realize that's over 50, over 60, over 70 years ago, 1948. HIV cases are also on the rise. And what did I say a minute ago? The same thing. And an international outbreak of monkeypox, of course, which is being spread mainly between men who have sex with other men, has further highlighted the nation's worsening problem, which diseases spread mostly through sex. Again, go ahead and go ahead and keep on just throwing caution to the wind and just saying whatever. It's about me, and I'm living for now. Okay, keep right on doing it. Keep right on doing it. And nobody is trying to put anybody down, but it's the truth. It's just the truth. Now somebody said better our sexual education. Well, I mean, I don't know how much more sexual education, how much better we can make it. I had sex ed in school over 40 years ago. They still teach it in school. So I don't know how much more sexual education you need to tell somebody, what not to do. Okay. I mean, I agree with this person, but I'm saying, okay, well, how much more sex education do we need? And I could go on, but you get the point. Okay. Let me just the last 15 minutes we've got, let me see. Let me go to these let's see. Now this one is, our hospital medicines harming patient. Okay. Let's see. Okay. And I, again, as I said at the beginning of the program, I often ask and wonder if a lot of the medicine, is doing really any good. It says 1 in 10 in high income countries is estimated that 1 in every 10 patients is harmed while receiving hospital care. This harm can be caused by a range of adverse events, which means nearly 50% of them being preventable. And I realize that they do all that they can, but the problem again is that there are mistakes made. And so, of course, you have to, nurses obviously and doctors have to be careful. Nurses especially, because they're the ones giving the medicine. Okay. Let's see. Okay. It says how many people are harmed by medication errors. Medication errors are among the most common medical errors, harming at least 1.5 million people every year. So that's a lot. That's a lot. Okay. So yes, as I said, you have, you gotta be careful. Again, the best thing, as I said, is to um, you know, uh, uh, not be on medicines as much as you can. Okay. Okay. Let me just look this up. I can. I'm trying to type. Just a second. Uh, okay. I can't. I can't. Sorry. I'm trying to type this and it's just not working for me. Oops. Oops. Oh gosh, I cannot get this. Okay. Okay. Oops. Okay. All right. Well, at any rate, everyone, I'm just going to go on because it's just really hard to type this, and I do apologize. I was trying to type up something, but it's really difficult because my phone is small. Oops. Okay. Yeah, like I said, I okay. Okay. All right. So again, with the last couple of minutes we have, we're just going to go to our last 5-10 minutes. So this is something I apologize. I said I was looking up something. Another 840,000 hospitalized patients are given drugs that cause serious adverse reaction for a total of 2.74 million serious adverse drug reactions. About 128,000 people die from drugs prescribed to them. This makes prescription drugs a major health risk, ranking fourth with stroke as a leading cause of death. And so, unfortunately, as I said, do prescription drugs a major health risk with few offsetting advantages. And so, again, says are pharmaceuticals leading cause of death. Annually, prescription drugs cause over 81 million adverse reactions and result in 2.7 million hospitalizations. The epidemic harm from medication makes up for prescription drugs and the fourth leading cause of drugs in death in the United States. And so, again, I'm saying please try and get off of these if you can. Please try and get off of these if you can. Um, if you can't get off drugs, prescription drugs, because again, it is it's not good. Now, I'm not saying that they've never helped anybody. I'm not saying that because I've taken them and they've helped me. But it's just, as I said, it's just very, very scary. Very scary. All right. And again, they give a whole lot of them. When I listen to, the nurse telling the patient how many drugs that they're giving them, I just shake my head. I go, God, Jesus. I mean, it's like, wow. I said, this is crazy. This is Dr. Wolf. They filled with boosters for Americans. Now, I talked to some man that had said he had all four, and he still got COVID. So, I mean, what do you say to that? He had all four boosters, and he still got sick with COVID last month. Okay, so again, and I'm sorry, I apologize. I'm trying to remember what his name. I know he's a doctor, and I've forgotten his first name. Okay, all right, all right. Okay. Okay. My. Says high school football players are being raped and sodomized by their fellow teammates as liberal public schools evolve into this dystopian horror movie. How awful! That's not something that you've been hearing about. My goodness. High school football players. Oh wow. Being raped and sodomized by their fellow teammates. Isn't that awful? I mean, wow. I mean, it's just so scary. So scary. Come on, being raped. So that means that maybe a lot of these young men that are in these high schools, a lot of them are gay or whatever it is, and they just feel like it's okay to do it. This is just crazy. I mean, this is really out of control. The bioweapon is the shot. Well, I mean, I talked about germ warfare, and whether you believe it or not, it's here. Bioweapons. If you don't think this whole thing had to do with germ warfare with China and bioweapons, you're not paying attention. The bioweapon is a shot. Diana West warns about the dark and evil nature of the COVID vaccine uh, uh, um, vaccine program. And so we're not trying to scare anybody, but we're just saying. We're just saying. Fauci admits he knew draconian mandates and lockdowns would harm children. So is he going to fess up? He's still saying that he wasn't to blame for a lot of the mistakes made. So, but they're saying here he admits it. So don't tell me it wasn't a plot and a scheme for a government takeover. It was. It was. Or some of it was helpful. A lot of it was not helpful. All right. Okay. Let's see. All right. Okay. Okay, let's see. Okay. One more story here. Okay. Of course, it says Nancy Pelosi extends proxy voting due to a novel coronavirus after Biden declared pandemic over. Like I said, that you can't even make it up simply because they want this to go on and on and on and on and on, simply because they've used it for their own benefit. Okay. All right. Okay. All right, everybody. We're going to end the podcast here. Thanks so much for listening tonight. I certainly appreciate everybody who tuned in tonight. Um, um, Again, I really do appreciate everybody. Last story: 98% of people eligible to receive um, COVID vaccine have not gotten one, which is again yeah, yes, yeah. Again, it gets crazier and crazier and crazier. So really, it just it is just really, really something. Really something. It is. All right, everybody. Again, we're going to end the podcast tonight. Thanks so much for joining me tonight. I want to say really quickly, of course, before I end, for those of you who are patriots like me, there's a remedy for this. There's a remedy for it, and it's called voting. November 8th coming, and although this is not a political program per se, um, please get everybody you know and vote. We've got if things you want things to change. Now, if you're happy with the way things are, I'm gonna put you on my prayer list because there's no way. I just read you some pretty bad headlines, and there's so many more out there. And if you're calling what's going on now okay and normal and and fine, then I don't even know what else to tell you. I do not know. I do not know it doesn't make any kind of sense. It really doesn't. It doesn't make any kind of sense. Again, it's not normal. It is not normal at all. All right. All right. Thanks again for listening tonight. Playing in the background is My Country 'Tis of Thee. Thanks again for listening. This is your host, Tammy. Thanks so much for joining me tonight. Please join me next Saturday night on for the Health of It Health Matters, 8 o'clock Central, 9 o'clock Eastern, 6 o'clock Pacific, right here on Podbean and also YouTube Live. Again, please tell somebody about YouTube Live. If you just want to watch the video, you can. Again, I appreciate you telling someone about it. Everybody have a great week. Please take care of yourselves. Again, it's so very important that we all do so we can stay healthy. Okay, there's a lot going on out there, but we don't have to become susceptible to it. We're already susceptible. We don't have to become, victims to it if we don't want to. All right. All right, everybody. Good night and have a great week. And we will be talking to you next Saturday night. Please, one more thing. Please tune into the Nation podcast on with this Wednesday night. The Nation podcast is Wednesday night, 8 o'clock Central, 9 o'clock Eastern, 6 o'clock Pacific on Spreaker.com. This is Tammy for America's Channel. The A is for action. The M is for motivation. E is for energy. The R is for responsibility. The I is for initiative. The C is for core care. And the A is for all. Again, please tell somebody about the podcast. If you watch my video on YouTube Live, please subscribe and then tell somebody about it. All right. Thanks again, everybody, and good night.